Hello everyone. Can you hear me now? Just write in the comment box if you can hear me, and I would know that you can hear me. Good evening everyone. That's perfect. If you can hear me now, thank you so much for confirming. Is my screen visible? Can you please confirm for me if my screen is visible? All right, then welcome all of you to the session today. Very good evening to all of you. I'm so sorry it took me a little while to log in actually. There was some network issue or something. It wasn't just working. The meeting I wasn't able to start. So this is why I kept you all waiting. I'm so sorry. But thank you all of you for being so patient and waiting for me. So in today's session that we're going to have, I'll start and discuss with you some tips and tricks related to your listening part A extracts. Is my PPT visible? The PowerPoint presentation, I'm not very sure. Let me just try sharing it again. Only black screen is showing. Oh. Just a second. Is something showing now? How about now? I'll wait for a moment, okay? Confirm for me now. I've tried it again. Just a moment, okay? I'm trying again. Is it now visible? I guess it is. Thank God. So yeah, once again, thank you for being so patient. Yes, you're right. I guess there is some network issue or something. That's the reason. It's a little slow in showing my screen, but it's now visible. I can see. So we are going to have this session today on part A, skills. Is the slide playing? Is the next slide playing? Oh, I'm not sure why it's not playing. And it doesn't go live. Yeah. Is it now showing? Wait for a moment. I guess it's a little slow. Yes, it's now showing. Thank God. Yeah. Okay, everyone. Yeah, it was a bit of a struggle. I'm so sorry. I'm not very tech savvy. And for some reason, the network is not allowing me to show my screen. I guess now it is. And the screen is off. No, screen is off. Evans, is the screen on now? Okay, Evan says it's off. Yes, it's showing. Thank you, Avanya. Thank you for confirming it for me. So, once again, thank you, all of you, for being so patient. I'll try and discuss with you some tips related to your OET listening part A in the session today. Let's see. I kind of hope that it really helps you with your part A skills, which is the most scoring part when it comes to OET listening. So let me see. Who are we? First of all, a little background on who I am or who am I representing. So I am Yukti and I am a trainer with Khaira Education. The next slide is playing up, which will show you what I'm about to say. Yeah. So Khaira Education is Asia's first premium preparation provider, and we offer a wide range of affordable courses, both online and offline mode. We have helped thousands of students pass their OET and fulfill their dream of working abroad as a nurse. Our Instagram handle, Facebook page, WhatsApp number, phone number, everything is mentioned on the screen. I will not take much time here, and you can even contact us through the comments, and someone from my team will get back to you, will reach you in case you want to join us for any online or offline course. So I'll move further here and I'll show you about the session. So in today's session, I am going to help you with some tips to improve your scores in listening part A, as I was discussing with you in the beginning of the session. And some of you have waited for me since 5 o'clock, and I'm really thankful to all of you for being so patient with me. Now, this session will have some activities related to the skills or tips, you can say, to improve your scores in listening part A. Listening part A is the most scoring part of your OET. So, in the session, we are going to do some activities that will help you in upgrading your skills of following a conversation, because that's what it is. In part A, it's a conversation between a specialist, a health professional, and a patient. And what do you need to do as a candidate? You need to find out a correct word to fill the blanks which are given in the question paper. And I am planning to help you listening to an audio extract here at the end of all the activities that we do. Try and attempting some questions on the basis of what we discuss. And by the time I show you the next slide, it's a little slow. So I would request you to utilize that time in writing in the comment box for me that where are you joining me from and what is your profession, and have you already taken the test, or are you planning the test soon? So it can help us in planning for the next sessions, which are lined up for you in future as well from me and my team. So please do write it for me. And with this, I'll start with the listening test format. Some of you may be new to OET. Some of you have already taken it, but some of you are new to it. So yeah, like you're saying, you've not taken it. So there are basically two consultation extracts in part A. There two speakers there are two speakers. One is a healthcare professional, the other one is a patient. And then there are 12 questions in each extract. After that, there are part B multiple choice questions, which are 6 short questions, and there can be either one or two speakers, and there are 6 individual questions here. Like in A part, 12 questions are connected, it's related to just one audio, but in part B, those 6 questions are related to 6 different audios, short audios. And in part C, again you have multiple choice questions, and there are 2 long extracts where again there can be one or two speaker. So basically in part A, there is always an audio where a healthcare professional is talking to a patient, and there are always two speakers in the audio, and each audio will have 12 questions. Okay, I can see there are students joining me from Sri Lanka, Philippines, and then India, Zambia. Thank you so much for writing it here. So what is part A about? I've shared with you the test format. If you're new, you have not taken the test, or you're still learning about OET, this is what you can expect from the test. Now, today's focus is going to be only on part A. So what is it about? Part A is about healthcare consultation, where a health professional talks to a patient, as I told you. And the outline is that there will be 2 audio recordings, healthcare professional plus patient in both the recordings, and each audio can last for 4 to 5 minutes. Each audio will have 12 questions, and those questions will not be multiple choice questions. Those will be fill in the blank style questions. So in these questions, like to answer these questions correctly, you need to complete the information. There will be some things written and some of the information will be missing, and there will be blanks, total 12 in number. So you'll have to complete that information with a word or a short phrase based on what you're hearing from the audio. So that's about it. Now, what basically part A is preparing you for? We know what the test format is, we know what part A covers, but what does it require you to do, or how is OET actually helping you from this? So, In your workplace, you often need to gather information from your patients or clients, and you would agree on this, all of you. When the patient comes to you, they have some problems, something to discuss with you, and you have to gather information. So you can provide them appropriate treatment, or you can direct them or recommend them the right kind of therapy. So to ensure the safe and effective care, you need to do this accurately, appropriately. So part A simulates this by using an audio extract from healthcare consultations. It helps you focus your ability to listen for detail, and this is very important. Part A questions are asking for a specific type of information which you're gathering from the audio. Yeah, so you listen to that 4 to 5 minute audio, and from that audio you're gathering some specific information. With the help of that, you're going to fill the blank. How to do that and what things can help you, we are going to discuss that. So let's start with our first activity of the day. I have here written 3 context sentences for you. I want you to look at these context sentences. So this context, this kind of a context will always be given on the top of the information. The 12 questions that I was talking about, which have blanks, which you're completing. So on the top of that information, there will be a context statement given, always and always. And that helps you understand that who two speakers are you expecting to listen to in this particular audio. So I have here written 3 context sentences. I want you to, in your head, underline the profession and predict any kind of conditions or injuries they might be discussing in this audio. So the audio will be 4 to 5 minutes long, a specialist and a healthcare professional. So, like the context number 1 tells you that you hear a dermatologist talking to a patient called Bobby Brown. So, can you type in the chat box for me? Who is the specialist here? Who are you going to listen to in this audio? Who is Bobby Brown talking to? Bobby Brown is your patient. Who is he talking to? What is the profession of the specialist in this context? Yeah, while you write your answers in the chat box, welcome all the nurses and doctors who are still joining me. Welcome to the session today. We have just started. You have not missed anything important. This is our first activity. So you can just read and follow. Yes, absolutely correct, all of you. Thank you for answering. Dermatologist is the specialist here. Dermatologist is talking to the patient. So just like that, can you write for me second and third one also? Like, what is the profession in the second context and the third context? Yes, skin specialist, dermatologist. And the second one, who is the specialist here? You can take your time. I can wait for a moment. Oh yes, Evans, they can be talking about rashes. You're absolutely right. Yes, that's right. Specialist is dermatologist. Physio, yes, they'll be talking about some exercises. Cardiologist, what will the cardiologist talk about? Yes, that's wonderful. Dermatologist, physiotherapist, and cardiologist are the professionals here. And what will they be talking about? What conditions or injuries could they be covering? Yes, it means heart problems. Cardiologist would be dealing with heart diseases. Dermatologist would be dealing with some skin problems. And physiotherapist will be discussing something related to patients' pains or injuries. Thank you for all the answers in the comment section. Wonderful. Now, how do you think this context sentence helps us? before the audio starts, we get information from this context, that who will be the speaker, who will be the specialist, and who will they talk to. The patient's name and the specialist's profession both are mentioned. And these two things are going to be very, very useful for us in order to help us understand the extract better, in order to help us understand the information better. Yes, that's right. Of course, we are not going to get any answers from the context, but it really helps us in preparing ourselves, that what are we going to listen to. Is there um, if there is a dermatologist talking to a patient, so in simple words, if I want to rephrase, being healthcare professionals, I keep on telling this in the daily classes to my students, that as healthcare professionals you have so much knowledge about these various things, about the diseases, conditions, treatment options, symptoms, etc. Now, OET wants you to listen to a specialist talking to a patient and gather some information which is missing. So you can utilize that information that you already have. You can utilize the knowledge that you already have in predicting the answers. Now, by saying that, I never mean that OET is testing for any of your special skills. No, they are not. They are not testing any special skill here. They only want you to fill the blanks, fill the missing information. And yeah, you're right. We can roughly have an idea what to expect from the audio and how to deal with the questions. So all the knowledge that you already have, you can at least think about a few words and predict some of the answers, the type of words which are missing. So never miss your context, always read it as it helps you. Now, what do we expect next? So, after reading and understanding the context, that is your step number one. When you get the paper, step number one is to read the context and understand who's talking to whom. Now, after this, you have to go ahead and read the information and where I want you to predict your answers. Now, for making predictions, some there are some tips that I want to share with you here. And for that, this is my second activity. So I have made a table here. On the left side of the table are some questions asked by the cardiologist. Now you're going to assume that a cardiologist is talking to a patient here. So on the left side of your table are some questions asked by the cardiologist, and on the right side are some responses from the patient. Okay, I hope you're getting my point. On the left side are some questions asked by the cardiologist. So suppose we are listening to an audio where a cardiologist is talking to a patient called Fiona Roger. So on the left side, A to E are the questions asked by the cardiologist during the conversation, and on the right side are some patient responses to those questions. What I want you to do, I'll wait for 2 minutes here and I want you to match the conversation. Example, for question A, the cardiologist says, don't worry, that's a good description. Does it radiate to your arm or jaw, or are there any other symptoms? So what do you think from 1 to 5 is going to be Fiona's response to these questions? Okay, take your time, go through it and match the conversation for me. A to E on the left side are cardiologist's questions, and 1 to 5 on the right side are patient responses. I'm going to wait for 2 minutes while you all match it for me, match the dialogue for me. You can write the answers one by one, like A and then B, or you can write them all for me at the end. Whatever is easy, whatever is convenient for you. I am going to wait for 2 minutes here. Please take your time. And by that time, if anyone new has joined me, welcome to the session. We are going to discuss Part A, tips and tricks. Okay, I've started receiving some responses. Wonderful. Thank you so much. You can go on. I'll wait for 1 more minute and then I'll show you the answers here. I'm waiting for 1 more minute till you all complete it. Great. That's wonderful. All of you have typed your answers here. Many of you. Go on, keep doing it. You are an excellent audience, very participative. I really appreciate. I'm going to show you the answers shortly. Yes, go on, please. Great. So here I am going to show you the answers. That's wonderful. Here you can see I have changed the screen. It will show in a few seconds. It will appear on your screens as well. Yes, that's correct. Many of the answers are absolutely right. That's wonderful. Thank you. Yes. So you can see, you can match, and side by side you can also tell me this time what is the order of the questions. Like where from A to E, where is this conversation starting from? Which one would be the first question here? Would A be the first question, B, C, D, or E? Which one is the first question? Yes, you've excellently matched it. Yes, that's right. Good. Now you have matched the conversation correctly. Now you can please tell me from where is the conversation starting? Yes, D is the first question here. They would start from good morning, Mrs. Rogers. How are you feeling? Then she would reply this, that you can call me Fiona. I'm feeling a lot run down. After that, what would be the second question here? Yes, first question is D. They would greet and start the conversation by asking what or why the patient has come to see them. Fiona replied to it that she is feeling a lot run down. And then what would be the second question? That's right. That's right. Absolutely correct. B would be the second question. The cardiologist would respond that they are sorry to hear. I'm sorry to hear that. And then they ask another question here. Since when are you feeling exhausted or tired? And Fiona says that it started a month ago. But what's worrying is that I feel my heart racing at times. That is Fiona's response. Now, what would be the next question? We are left with A, C, and E. From A, C, and E, which one would be the next question? So, first question is D. That's how the conversation would begin. B is the second question. On the right side now, the right response is written also. You can read it. What would be the cardiologist's third question as per the table that I'm sharing with you? C, that's wonderful. Wonderful. C. They would say, I understand, Fiona. Heart palpitations can be concerning. Do you get them while doing something? And is there a pain too? Because there was less space, so I've written two questions here from the cardiologist, to which Fiona, the patient, replies, yes, I get them when I'm walking up and down the stairs, and there is chest pain at times too, but not always. That is Fiona's response. Now we are left with last two questions, A and E. So which one after C? Which one after C? That's right. That's right. That is the fourth one, but I'm getting only one response here. So I'll wait. Yes. D is the first question. B is the second question. C is the third question. And fourth one is yes. Yes, I've gotten an intelligent audience here. E is the fourth question. E, I see how would you describe the pain that you get occasionally? That's wonderful. That is what the cardiologist would say. To which Fiona says the pain is sharp and like a crushing feeling in my chest. I don't know how to describe it exactly. And then the last question, that is A. Don't worry, that's a good description. Does it radiate to your arm or jaw, or are there any symptoms? To which Fiona says, no, it does not move anywhere, but I have to sit till it settles down and I feel like my head is spinning afterwards. So that was just a part of a consultation, and it's just to show that how there can be a question answer thing, because it's a dialogue in part A. So cardiologist is going to gather a few things, ask a few questions, to which the patient will keep on responding. Now, so we did two activities so far. First, we learned how context is helpful. Then we learned a little about how the conversation is going to be in the audio. The cardiologist will ask some questions, to which the patient will give detailed information. Now, since you've perfectly done the activity so far, so now I'm going to check a little from this information. Do you think the sequence of information giving in patient notes is similar to the order in which it appears in the audio, or is it different? That means, what I mean to say is, will the information that I showed you, the conversation that I showed you, is it going to be in the same order? The questions that you have and so the audio that plays, will the order of information be same? So the answer is yes. It always follow the same order. It will never be different. It will never change. Okay, yes, wonderful. I hope that you easily clear OET also, just like you easily answered the questions to my activity. It is going to be easy for you to clear OET as well. Yes, I'll hope for that. So yes, the order of information in which the consultation is played in the audio and the order of questions is always same. So what is different? Is the language different that is used in patient notes, or is it also slightly same? So the order of information is same, but is the language also same? What do you think about it? Yeah, so I asked the order question because we were doing an activity previously. So someone who can be new to OET may think that you have to, just think about the consultation and do something like this. So no, it was just an activity to understand something. But is the language also same? Meanings are similar, but are the words also similar as it is? What is written in the patient notes, will it be as it is used in the audios as well? No, you're right. So that is the catch here. The order will never change, but the language will. And how will it change? It is paraphrased. It is not exactly similar. The meanings do match as it is, but the language does not as it is match. It'll be different. Patient may use some common words, that is informal language, to describe about their condition, their situation, pain, etc. But the notes that you have will have medical words written in them, like more formal kind of a language is written in the notes, and informal language will be used in the audio. Why is this? Because patient is not very familiar with the medical jargon, right? They being um unaware of these things, what is happening to them, what exactly are they going through. So they don't know what do you call them in medical terms. So this is why they are going to use very common words or language to describe their symptoms or their situation or their condition. Health professional, on the other hand, is going to describe things in a simple manner yet formal, and the notes that you will be having in front of you are kind of case notes there. So I always tell students to imagine that when they are reading the context statement, they are sitting in that room where the specialist is talking to the patient. Like in this case, if cardiologist is talking to the patient Fiona, then if cardiologist is talking to the patient Fiona, then what is going to happen in that conversation? You get an idea from the context, and then when you're sitting, when you imagine that you're sitting in that room, you can just assume that you are writing the case notes for that person. So that helps you. And yes, my cross, I really kind of hope that the goddess helps you in passing OET. So, to understand this better, we are going to do an activity by which I'll help you understand how patient paraphrases the language and notes have a kind of an informal thing written, a formal thing written. So for that, I'm going to move my slide here. So I have some words written for you. Yes, OET indeed is a blend of hard work and destiny, but I'll say pay more attention to hard work rather than just praying for your results. You can pay more attention to hard work, and if you practice regularly, you keep doing samples, surely you will pass. Our good wishes are with you. So yeah, now this activity is going to help you understand how and why I'm saying the information is paraphrased. So the patient is using some words which they are commonly using in their day-to-day life, and the language that you have in notes in front of you will not have that day-to-day life words or informal language written. It will have more of formal language written. Like I have given one example on top. Excessive compressing feeling in the chest. If a patient who comes to a cardiologist is experiencing, like Fiona was experiencing, excessive compressing feeling in the chest, so she's calling it crushing chest pain. That is a day-to-day word to describe it. Now in your medical terms, it could be called angina pain or something as well. I am not very good with that, so probably you can tell me better. In your medical terms, you may be using some formal some medical words for that kind of a pain that Fiona is experiencing, but she in normal day-to-day language is calling it crushing chest pain. So similarly, if The patient has to tell the specialist that they are exhausted, lightheaded, or they have heart palpitations. So, what words do come to your mind? You can type in the chat box whatever comes to your mind that the patient may be using in case of exhausted. That's right, it could be tired, heart palpitations, okay, frequent touching heart, yeah, that's a good try. But yeah, that could be but not exactly, because you can't touch it. No, it's an internal organ, so no, they might not be using that. But something else, that's right, occasionally can be on and off. Wonderful. What can lightheaded be? Heartbreak. All right. Heart palpitations, heartbreak. Yeah, heartbreak feels like heart palpitations. Yeah, you're right that way. But the patient here is not going through a heartbreak. She's having a serious condition like crushing chest pain. Yes, heart racing is a better word. Heart racing, that's right. Occasionally can be sometimes. Wonderful. And lightheaded can be feeling better. Okay, you're close. Good try. Not exactly. What else can it be? Dizzy spells. Yeah, that's right. Thank you for that. Dizzy spells. And what about radiate? We missed the last one. I hope it's also visible. Yeah. Heart pounding. Yes, that is also a very good word. So the patient can be using these. Some of them you have written in the comment box, and some I am showing on my screen. Exhausted could be tired, or if you can recall from the conversation, Fiona is saying run down. That is also a way of saying that someone is tired. Run down. I'm feeling run down. Lately could be recently. Lightheaded, yes. Dizzy, or in the conversation that I showed you, if you can recall, she said my head is spinning. Or sometimes the patient even says, I have heard that in some of the audios, that I was standing still but the room was moving. That is also another way, because of course the patient does not know what is the right term to describe it. So you as a specialist, and similarly in the audio, that specialist is trying their best to understand what the patient is saying. Heart palpitations can be heart racing. Heart pounding is another good word written in the comment section. Sometimes, occasionally, on and off, another way. And radiate is moving, or sometimes the patient can also be saying that my pain is shooting. It's shooting to my ankles from my knees. That means it's moving quickly to the ankles. Yeah. So, a quick recap so you don't forget what we are doing. Step 1, you understand your context sentence and then prepare yourself that what you're going to listen to. Step 2, you read the information keeping in your head that the language that you're going to listen to in the audio will not be as it is similar. There can be similarities in some words, meanings will as it is be similar, but the words are going to be little different, and that is the catch. Reading patient the notes and listening to the audio, you have to fill the blanks. Now, last step with the last activity, and then we are going to practice some questions with the audio. So this last activity is going to help you with the last step, which is going to be very, very crucial when it comes to predicting or anticipating the answers. Yeah? So on your screen now is another table where on the left side are some subheadings written, and on the right side are some notes given. Yeah, like earlier I gave you proper sentences which the patient is using and the questions that the cardiologist was using. Now I have written them in note form for you. So all these notes can be categorized using the subheadings on the left side. I want you to take help from the notes on the left side and use the subheadings. Oh, I'm sorry if my audio is very slow. It could be network issue. I am not at all speaking slow. I am speaking at my normal pace only. It's coming slow due to network issue or I don't know what reason, but I am speaking at my normal pace only. Yeah. So please do this activity for me. Take. I'm going to wait for 1 minute. It's an easy one. You can easily do it. A, which are triggering factors or identification of the triggers, or when the cardiologist wants to identify the triggers, 1 to 5, which notes will fit under this subheading? Which notes will fit under this subheading? Yeah, go on, please. Yeah, A, identifying triggers. That is right. A is 5. Stress, physical exertion doesn't happen while resting, consuming excessive coffee, making it worse. So all of these could be triggers, triggering factors. Then what about symptoms? Discussing symptoms. Which notes will fit here? Discussing symptoms. 1 to 4. You've already. Yes, that is again excellently done. B, discussing symptoms is 3. Feeling tired, sharp, intermittent chest pain, moves to the left side, reduces on sitting, increases while working. Excellent. What about the next one then? C, introduction and medical background. C fits with C fits with 4. Yes, that is right. A fits with 5, B fits with 3, and C fits with 4. Introduction and medical background. So GP has referred for reoccurring chest pain. Patient has diabetes, father died of angina, patient is generally fit. All these details can come under C subheading, 4th one. And D, associated symptoms. Which one can be associated symptoms? We are left with 1 and 2. 1 and 2. Which one goes with D? Yes, you're right. A is 5, B is 3, C is 4, D is 1. Wonderful. Excellent. D is 1. Associated symptoms can be shortness of breath, dizziness, nausea, along with or after the pain, left arm feels weak. These can be associated symptoms. And the last one, E goes with the second one. Suggested tests and recommendations. Evaluation through ECG, stress test, strenuous activities avoided, relaxation techniques to be used. Great. So excellently, you see, you have used these notes and put them under the right subheading. OET will do that, or they will do that for you. You just have to utilize it in your favor. And how will you do that? So keeping everything in mind, we are going to try some questions here. So I don't want you to forget everything that you just discussed with me through the activities. Keep in mind whatever we discussed so far, whatever you've learned through the activities. And on the basis of that, we are going to practice a part of an extract of part A, wherein you're going to listen to a nephrologist talking to a patient called Victor Lucas. So one last quick thing before I show you the questions. I know you're waiting patiently to practice the questions with me. And I thank you for all your patience and your participation throughout so far. But I want you to take one last minute And quickly tell me, what do you expect a nephrologist to be doing for the patient? Because this is my context now. The audio that I'm going to share with you will have a nephrologist talking to a patient who is Victor Lucas. So Victor Lucas is the name of the patient. And what do you think a nephrologist is going to do for that patient? I'm going to wait for few seconds only. So you can quickly write your answer in the chat box here, and we are going ahead with the questions. Then this is the last activity that is going to help you with the questions, and then I'm going to straight away take you to the next slide having questions. That's wonderful. Thank you, all of you. Nephrologist is going to help with the kidney problems. They specialize in diagnosing and treating kidney conditions. Now, let's start. You get 12 seconds to read. You get 30 seconds to read 12 questions, but I'm going to give you 30 seconds here to read 7 questions. And I hope all the activities that we are doing and we have done so far are going to really, really help you. And you can find the answers for all these 7 questions here. So context, already you're aware. A nephrologist talking to a patient, Victor Lucas. Nephrologist is going to specialize with kidney problems, kidney conditions. It could be helping the patient with a diagnosis, or probably they are already diagnosed and the nephrologist is helping them with a treatment. It could be anything. But on the basis of that, just like I said in the beginning, that's your step 1. Understand the context. Keep in mind the context, and now we are going to quickly predict the type of words that we are going to look for. Subheadings are written in the bold here, and in the paper also subheadings will be separately written in bold. Symptoms and preliminary investigations, these are your subheadings. Just like you did the last activity for me, where you were categorizing information according to the subheading. So here also OET has done that for you. They have categorized information on the basis of subheading, and you're going to just read the information. Crucial thing to be aware that the words will not come as it is. The order of the conversation will be same, but the words will not come as it is. So patient can use informal language, notes have formal language. Based on that, let's predict. Symptoms. So bullet point 1 says, felt unusually fatigued. That is what the patient says. Like we have discussed, the patient might not be using the word fatigued here. They may be saying something else like exhausted, run down, tired, anything. Suddenly developed. Now this one is incomplete. So what word do you think can fit in here? Suddenly developed. Can it be a name of a symptom? Because my subheading is also saying that symptoms, and suddenly developed something. So can it be name of a symptom here? When I say predict answers, or when any of your trainer says predict answers, we never want you to predict the exact answer. Okay, keep that thing in mind. I want you to only predict the type of word that you're looking from the audio. Right? So when here they say suddenly developed, so can it be name of a symptom that has suddenly developed? Yes, it is going to be name of a symptom. So for first one, I'm going to look for name of a symptom. It could be anything. Yes, you can keep all this, what's coming to your head, abdominal pain, severe pain, etc. You can keep it there in your vocabulary box that is safe in your head, but you don't have to write it anywhere. You only have 30 seconds, so you have to be very quick with this thing. Suddenly developed. So in my head, when I'm reading it, I'm thinking it has to be name of a symptom. Name of any symptom. It could be pain, it could be anything else. Name of a symptom. Noticed a dash, feeling. Now for the second one, I am looking for name of a feeling, because the word feeling is already written. It could be any feeling, and all the words that are tingling, throbbing, crushing, etc., etc., again in my vocabulary box in my head, they are safe. If they come in the audio, well and good. If they don't, I am not going to assume answers. So first one, name of a symptom. Second one, name of a feeling. Words can be different, feeling can be sensation as well. Experienced, uncharacteristic. Now very nicely they have written here the word uncharacteristic. That means something which is not usual for the patient. Uncharacteristic would mean that's not patient's usual character. So some experience which is unusual for him, new for him these days, that will come in the third one. Sometimes became, again there has to be something he has become now. Now it has to be again a situation. Example, if there are two terms, obesity or obese. So became, what will go with became? Now it has to be obese, not obesity. So there will not be name of a symptom now. Obesity or something can be, or breathlessness or tiredness, these can be symptoms, but here there is something the patient says they have become, so it's a kind of a situation they are in. Was occasionally aware of, that means something that they have noticed. What are they aware of, or what were they? Was occasionally aware of, so something that is quite noticeable. And then there are preliminary examinations. GP suspected underlying issue with kidney. Suspected, so that's not confirmed. CT scan and dash carried out. Now, what will be sixth one looking? What are you looking for to fill the blank here in the sixth one? It says preliminary investigation. That means you're looking for another test or something that is done, because it is carried out. And on kidneys, that again helps you narrow down your predictions, that it has to be a test or a procedure that can be done for his kidneys only. And the last one says a possible link to dash was ruled out. A possible link to dash, that means a condition or something was ruled out. So this way, now we are discussing it in detail. That's why it is taking us a while. It took us a little time. During your exam, you're getting only 30 seconds to do this for 12 questions. So you have to be quick with this. But don't worry, it's not difficult. When you keep doing it every day, it becomes easy for you. All right. So now what we're going to do is, I will play the audio and you're going to answer these for me. Are you ready? Okay. I'm going to quickly play it for you and you're going to answer. I'm sorry, by mistake I clicked on the slide and it skipped, but I'm back and no cheating, okay? No cheating, anyone? So I am playing it and you're going to write the answers quickly in the chat box for me. Quickly write the answers for these 7 questions and then we will check the answers. All right? So let's go.
So, Mr. Lucas, I have your notes here, but I wonder if you could tell me in your own words what's brought you here today.
Well, towards the end of last year, I had to take some time off work because I was absolutely exhausted. I didn't really know why. It was a level of tiredness I hadn't felt before. Then, one morning, I found I had slightly swollen legs. It was really alarming because it literally happened overnight. It wasn't like anything I'd experienced before. And it wasn't the only thing that was going on either. I had this strange tingling sensation in my wrist and some of my fingers, though no actual pain.
I see. And were there any other symptoms?
Well, I used to love my food. In fact, one of my passions is cooking for friends and family. But I was suffering from a complete loss of appetite.
I see.
It wasn't like me at all. Generally, I didn't feel that well, and I wasn't in the mood for doing anything very much. Occasionally, I'd get short of breath too. This could happen even when I wasn't doing any exercise or anything. A few times, I thought I noticed an irregular heartbeat. I was very worried about that.
Okay, so when you saw your GP, he wasn't sure what the problem was?
No, it was such a strange mixture of symptoms, though he reckoned there might be some problem with my kidneys. He said I needed to go and have some tests at the hospital, and that made me even more anxious, to be honest. Anyway, I had a CT scan and a biopsy to check things out. This showed that I'd got these protein deposits in my kidneys. I can't remember the name, though I was told stuff like that, actually.
Right. It's called an amyloid, but don't worry about the medical terms.
Okay.
Anyway, at this point, you had some other things checked out?
Yes. Fortunately, the blood tests I had didn't find the same buildup of protein in the heart. That was a relief, because apparently that's much more difficult to treat.
Yes, indeed, that's true. And I understand that it was confirmed that your condition was unrelated to anything else.
I was told that sometimes what I've got is a sign of a type of bone cancer, but I was given the all clear as far as that was concerned.
Okay. Now, as soon as the diagnosis was made, you were given some detailed advice regarding.
So, as I told you in the beginning, because this session is a little short, we're going to do only part of an extract and not a complete extract. But don't worry, I am going to share the complete extract with you and you can do it. I'm going to pin the link of the audio answers and everything in the comment section. You can do it later. So what I'm going to do, I hope you've done that. There was no issue with the network, and here I'm showing you the answers. So just like we discussed in the beginning, you see some answers you very nicely predicted already. And it's good if the words that are coming to your head are matching with the words which are there in the audio, then that's a bonus. But my aim when I'm predicting the answers is not that. My aim is not to predict the right answer. My aim is to predict the type of answer which can fit in here in the blank correctly. So in the first one, as you can notice, the patient said slightly swollen legs, but slightly is an extra part of your answer, and you do not have to waste your time writing that because it's going to be lengthy. Now, when the next answer comes and you're busy writing the previous answer, which is lengthy, it may take some extra time and you may miss the next one. So just go for short answers and phrases which are necessary. No extra details required. So swollen legs can be your answer here. Noticed a name of a feeling it was. So tingling. Feeling is already written. The patient said sensation, but you don't have to copy that. It's already mentioned. And yes, the next one is absolutely right. Loss of appetite. That is something that's new. Sometimes became. Now here some candidates make a mistake. They write shortness of breath because they see that it is a symptom. So they write shortness of breath. But that is going to be wrong because it's not what someone can become. Someone can become short of breath or breathless. They cannot become shortness. Okay. So read it carefully and don't worry. Even if by mistake you wrote shortness instead of short, after part C, you're going to get 2 minutes to check your answer, in which time you have to come back and read it. Now, when you proofread your answer, you can make the changes. So, sometimes became short of breath. Irregular heartbeat was the next answer. Many of you have written that correctly here. And then biopsy and bone cancer, which was ruled out. So 7 answers and most of you have written them correctly. So that's excellent. Now I'm going to show you the last part as well, but we will not do it. Okay, I am only showing you the questions here. So you're aware it was a complete extract and it has some questions which we haven't done due to short because we are running a little short of time and the sessions are not that lengthy. But don't worry, as I said, you can do it in homework. I will add the details or the link which can take you to the extract. It will have audio and it will have a detailed transcript plus answers which you can self-assess after attempting it on the basis of all the activities that we have done. So good job all of you. Thank you so much. Once again, I am very thankful that you were so patient initially when we were having issues in connecting and everything. You all were so patient and you waited for me patiently. And then you were you participated so well and you were responding promptly in the chat box. I'm very, very thankful for that, for your participation. I hope these activities have helped you a little. Remaining part you can do as homework. As promised, I'll share the details with you. And if you like the session and you want to join us for classes or you want inquiries, we have offline centers in Mohali, Delhi, Amritsar, and online you can join us from anywhere, from the comfort of your home, your workplace. You can join us. The details of uh, my school institution, Khaira Education, are displayed on your screen. We are on Instagram. You can find us on Facebook, our WhatsApp, and contact details are given. You can reach us out on call, on WhatsApp, whatever is convenient. So that is it for the session today. Thank you so much for joining. Yeah, I'll surely help you with more sessions like that, and those are lined up in the future. But for more skill lessons and everything, the inquiries that you're making, you can please contact on this WhatsApp number, or else you can leave a comment here. My team will reach out to you. Thank you so much, everyone, for your time, and I will see you when we have the next session. Thank you, and bye. Good evening, all of you.